Good. So let's talk about that. The whole fact that a baby that's been substance exposed, now has a greater risk of SIDS.
Yes.
And so, what are some of the things that a parent can do in that regard?
Yeah. So SIDS with any kid, but especially someone that is substance abuse, something that I'm really deeply passionate about, because mostly it's preventable. I mean, obviously things happen that are out of your control, but one way to prevent that is when you do your bedtime routine, having a fan on in the room, ceiling fan or anything else that's just a low fan to circulate the air there are research articles about this, and I can't remember the specific stats, but it's there's a high correlation between having a fan and a decreased risk of SIDS, because the air moving helps the body to naturally continue to breathe regularly. And so that's a huge deal. So safe sleep, we know, is, clean bed, swaddling, arms in, if they aren't rolling over, arms out, if they are rolling over, and then making sure that it's a safe sleep practice to have a fan on in the room. Checking for your temperature correlation. So SIDS, we know, decreases between 68 to 72 degrees in the room. So that's integral. And then making sure that you are looking at how you're layering your child's clothing in that process as well. So look at what you're wearing to bed, and then compare that to them. And then in the middle of the night, if you wake them up, check that the tummy is a reasonable warmth, that it's not too hot, not too cold, you'll see extremities just be chillier at night. It's just natural for all of us when we're sleeping, but tummy, neck, back. So low fan in the room, though, really is something that I didn't know much in nursing school. And then as I grew in my career, how important a fan is in the room to help decrease SIDS as well. So.
Wow, that's interesting. So. And so why do you think there is a correlation between the substance exposure and the risk for SIDS?
Yeah, so you typically, depending on the type of substance exposure, you might see like smoke causes lung issues, they'll have smaller lungs, or problems with breathing. If you're on drugs, you'll see, or if they're drug exposure, you'll see different problems with the neurodevelopment process. And so there are some autonomic processes that aren't as strong, or neurological processes that aren't as developed in a baby who's been exposed to drugs or alcohol. And so looking at the practical ways to intercede for their life really is looking at care for sleeping when you're not in the room right with them.